the logistics, but we're ready to start our panel. So I just wanted to start by saying hello, everyone, and welcome to our panel discussion titled Strides in Digital Health. This session aims to shed light on how digital health initiatives are spearheading remarkable progress in communities across Africa, Asia, and Latin America. We're here to explore the transformative impact of digital health on advancing healthcare systems, hoping to inspire our attendees with the vast possibility that digital innovations bring to global digital health. Let's introduce our esteemed panelists who have been at the forefront of this transformative journey. First up, we have Dr. Jay Ganesh, the Executive Director of the Asia eHealth Information Network. With over 19 years of experience, Jay has been instrumental in the planning, procurement, and implementation of enterprise digital health solutions. His involvement spans from hospital information systems to telemedicine and chronic disease management portals. Jay's contributions to digital health are recognized globally, serving on advisory and expert committees, including the Global Digital Health Network and the World Health Organization's normative guidelines on digital health and telemedicine. His efforts in national HIS strengthening and digital health convergence workshops across Southeast Asia and the Western Pacific region are commendable. Next, we welcome Daniel Otzoy Garcia, a visionary in the field of digital health. As the co-founder and global CEO of Recainsa and a technical advisor at John Snow Inc., Daniel's work in digital transformation has been influential across Latin America, the Caribbean, Africa, and the Southeast Asia. With over 18 years of experience, he specializes in adopting digital health strategies, health data governance, and interoperability standards. Daniel's extensive work also covers digital transformation and cybersecurity, showcasing his diverse expertise. His leadership role in the leading digital transformation and healthcare program at Harvard University underscores his commitment to educating the next generation of digital health leaders, further amplifying his influence on the global health landscape. And last but not least, our third panelist is Jean Philbert, the Chief Digital Health Advisor at Africa CDC. Phil, a former Minister of Youth and ICT in the government of Rwanda, has been a pivotal figure in propelling digital transformation and youth empowerment across Africa. He spearheaded initiatives like the Africa Smart Alliance and Youth Connect Africa, aiming for digital inclusivity and technological advancement. With a rich educational background, including a Master's of Public Administration from the Harvard Kennedy School of Government, Phil's leadership and vision have significantly contributed to unlocking technology and data for Africa's prosperity. Today's session promises to be an enlightening exploration of the cutting-edge advancement in digital health. Our panelists bring a wealth of knowledge and experience from different regions and sectors, making this a unique opportunity to learn about the global impact of digital health innovations. Please join me and warmly welcome our distinguished panelists as we dive into strides in digital health. Well, so first off, I would like to start with Dr. Jay Ganesh. We are wondering if you could describe the major digital health initiatives within the Asian region that you and your organization are currently working on.
Thank you. I would say that there have been many initiatives as a network we have been working on, but I would like to recall a couple of them. One is the GAPS framework, which is like we have this acronym of governance, architecture, program management, standards, and interoperability. Because we as a network now, we have been working in the region for more than 12 years. We realized most of the challenges in terms of national digital health transformation can be addressed if we are able to identify the gaps in terms of governance, architecture, program management, which also includes the workforce, the people, and then the standards and interoperability. So we had this kind of a survey done in the region way back in 2017 when we had an annual general meeting. But then last year, we got together by working with our working council members. Working council members are actually mostly the Ministry of Health representatives are the focal points for HIS and digital health. And they are actually working with us closely from these countries. So we got them all together and revisited this framework and then took the feedback. And right now, what we are at the stage of actually with the feedback and the inputs that we got from this, I think around 13 countries in our region who participated in the survey last year. This year, we are actually working with them to advocate with the political leadership or the senior management. So that is one project. But I would say that like the objectives for this call for action, it is also a regional call for action. This is for taking impact-oriented actions to improve digital health strategy design and implementation to propel overall digital health maturity in the region, and then also to harmonize digital health ecosystem with countries' overall digital economy, and then to ensure accountability for actions and build capacity and ownership among uh, the, the leadership as well as the people who are actually the key decision makers and then all the user champions that we can call. And then also mainly to promote multi-stakeholder coordination to onboard health as well as non-health stakeholders, public, private, and NGO sectors, because this is something very important. We can't do this in isolation because digital health, by nature, it is inherently multidisciplinary and multi-sectoral. So we certainly need this kind of a coordination among multiple sectors in the country. And then the second major project, I would say, that among many that we did is Convergence Workshop Toolkit, which we have updated. We already had this toolkit. The Convergence Workshop is something that I might have. Let me know if I have time to describe or I can do it a little later. Convergence Workshop is nothing but bringing together various national stakeholders as well as the donors, the development partners together to understand what is the national digital health vision. If the country already has a strategy, then how different stakeholders can actually come together, align their resources to actually implement the strategy. If the country does not have a digital health strategy and the costed blueprint, then how we can convene these different stakeholders and align their resources, the energy, the efforts to actually have a national digital health strategy and a costed blueprint in the country and then have it implemented. So I would say that these are the tool categories. We already had a toolkit which was released in November 2018 with the support of Asian Development Bank based on our experiences of convening this convergence workshop. But after 2018, we have done several convergence workshops. So we brought together these country experiences and then also had this endorsed by the ministries with whom we work together and have this convergence toolkit ready. Right now, like we are at the stage of launching a microsite and very soon it will be available. I would say these two among many that of course we also work with Health Enable for the global digital health monitor and then we also work with several countries working together and supporting their digital transformation. But I would say that these two are, I would say, a regional effort that we work together. Do you think that like you have any other questions? I hope I answered this question, but if you have anything, I can clarify.
No, that's perfect. Actually, I find it very insightful, and I think the public as well. Um, it is very interesting to bring to the topic about like the convergence of stakeholders. I think that it has been like a frequent kind of topic that we have been dealing with here at the School of Public Health. I would like to know more from Daniel's or Phil's perspective on their region about initiatives when it comes to converging with stakeholders or other projects that you have going on in your regions.
Well, thank you very much for the opportunity to be here with friends like Jade, and we have many years working together. They in Southeast Asia, we in Latin America. So, well, we have common initiatives actually, like I think we are working in topics like data governance, promoted by the coalition Transform Health. Actually, we will have some public consultations in 3 countries in the next month. We will have one in Bogota, one in Argentina, and one in Dominican Republic. And this is because we are very involved in the promotion of the data governance, health data governance framework. But additionally, we are working in 4 main areas in the region. The first one is governance, the regulatory frameworks, and investment frameworks too. So we are advising some governments in the region for the elaboration of the national digital health strategies, for the review of the regulatory frameworks, for example, for upgrade or update the laws, the regulations, taking into consideration the framework, the global framework, regional framework promoted by WHO, by PAHO. Additionally, we are working in a second area that is the digital health literacy. In that part, we have some regional programs, training programs. The most important and famous is the Women Leaders in Digital Health. Is one training program, 12 or 14 weeks, more or less, where we have 30 women for each cohort. And we train these women with the support of a university in the region. And we cover 3 main areas. The first is leadership and gender. The second is organizational transformation. And the third one is digital health. So at this moment, we already have had 3 cohorts of women. We hope to have this year the 4th cohort. And we have created around this training program a community of practice of women leaders from different countries, from different sectors. We have former ministers, we have business women, we have medical doctors, we have psychiatrists, we have psychologists, we have nurses, etc. So it's a community more or less 84 women forming this community of practice. We will launch in the next weeks a public policies program for digital transformation. This is an effort that we are creating with the University of Buenos Aires, actually, and is focused in the decision-making layer, especially policy makers, advisors that are very involved with the ministries of health, the ministries of technologies, because we have identified this important challenge, as I mentioned in the previous area. The third area where we are working is like I think promoting the use of standards for interoperability specifically. We have a very strong approach for the design of architectures based in the best practices and based in the standards promoted by the different organizations, agencies. We are part actually of HL7 International. We are in the process to create a affiliation with 8 countries in Central America and the Dominican Republic, taking advantage that those countries have a supranational mechanism for the economic, social, and political integration. So we took advantage of that and proposed to HL7 to create a affiliation integrating those 8 countries. And we are very confident that we will obtain this approval probably in the coming months. And the last area of work is the generation of evidence. That's an important area for us because one of the challenges in Latin America is to publish, is to show the things that we are doing. We are all the time implementing things, but we never show the things that we are doing. So this is an important challenge. We are promoting the use of different maturity assessment models for the information systems for health, for example, that is promoted by PAHO. We use the monitor, the Global Digital Health Monitor, for example. We have other maturity models more related with AI, the adoption of AI in the health sector. But we are working very close with the academia too. Actually, we are in the process to sign an MOU with Johns Hopkins University, actually, for promote the research in the region, for promote the exchange of researchers, and promote new ways of training in this more skills and capabilities approach. So I stop here, but happy to amplify more about our work. Thank you.
Wow, thank you. That was extremely enriching to get to know. Also, I come from Honduras, so I hope that the initiatives there are strong. Also, I would like to move on with Phil. It is very interesting to see how involved you have been with youth and youth initiatives. And I think that the audience is also interesting to learning more about the projects you have going on in the African region.
Yeah, absolutely. Thank you so much for the opportunity. I'm so pleased to meet, I would say, my twins. When I look at Jay and Daniel, one standing from Latin America and then from Asia, we are the latest kid on the block. One of the initiatives that I want to talk about is the setup of the Africa Digital Health Network, which will be the equivalent of AHEN or ACANSA. So I want to leverage all your experiences and learn from your lessons, and most importantly, avoid the mistakes that you have already paid for. I serve as the Chief Digital Advisor for the Africa Centers for Disease Control, an institution that is 7 years old. So I will speak from that perspective, what we are doing to really help advance Africa's health security using digital technologies. It's a pretty recent effort. I am starting the digital health unit within Africa CDC, and it's been a journey of about 2 years, slightly less than 2 years. So keep that in mind. We are running multiple efforts. We launched our digital transformation strategy in March last year with about 10 major projects. But today we are talking about 14 projects that I can group into 3 major categories. The first category is about primary care digitization. For context, again, Africa bears 25% of the global disease burden, but it has only 1.3% of the world's doctors. So technology is the only way we can leverage the few qualified human resources we have to be able to reach the population. So part of the primary care digitization effort consists in trying to connect 100,000 health facilities and 2 million community health workers, but also rolling out different other initiatives like connected diagnostics to be able to strengthen our pandemic preparedness, prevention, and response by detecting outbreaks before they turn into major health threats. And we are also running several other initiatives in that area, such as electrification, connectivity, and implementation of electronic health records and other program-oriented tools and softwares, really to drive towards a future that is a paperless primary care, a very ambitious goal, but we believe that we'll get there. So that's the first category. The second big category has to do with innovation. How do we tap into the very abundant talent of young people that this continent has to shape the future of healthcare? So the initiative is called Health Tech Innovation Marketplace. And as part of that, we've got something called Data and Innovation Sandbox, which is a platform that allows us to identify, vet innovation, and be able to tell to our member states that these innovations have been checked. You can feel free to engage with the innovators and sort of overcome the analysis paralysis that has hampered the scale of health tech innovation for many years, not just in Africa, but elsewhere in the world. We have initiative on AI for health. We are looking at different ways to mainstream the use of AI in different areas in different programs. We are looking at health data governance as a separate initiative working with Transform Health and other partners. And we are also looking at how we measure progress by launching an Africa Digital Health Index, which is based on the Global Digital Health Monitor. But for us, we want to be able to go one step further, rank the performance of countries to sort of bring some healthy competition. The last one, the last group of initiatives is about the digital health human workforce development. We're about to launch an Africa Public Health Informatics Fellowship to train the leaders, not just leadership, but also project management, communication, really to have the people who will be in charge of leading the design and implementation of digitalization programs within ministries of health and public health institutes across the continent. We have several major initiatives to strengthen communities of practice. So I talked about ADHN, the Africa Digital Health Network, but we also have major convening platforms such as the Africa Health Tech Summits, which take place every October in Kigali. So I want to invite all of you and happy to share details later. We've launched the Africa Women in Digital Health in recognition of the role that women play and have to play in shaping the future of health. We are also supporting several other communities of practice that are in formation, including a major Africa Youth in Digital Health Network. So primary care digitalization, health tech innovation, acceleration, and digital health human workforce development. Those are the three major flagship initiatives that we are driving. Thank you.
Okay, thank you for that. Actually, it is very interesting to see how by regions, it also has a lot of similarities in terms of like priorities and projects. I would like to know more about like personally, what do you identify as the biggest barrier or concern when it comes to digital health? Like also, is there an area within your region that you're particularly having more, I would say, challenges with? I guess Phil can start, and then we can, yeah.
I can go first on this one. So I would say the major challenges are aligned with our major priorities. So as we, for example, try to advance the digitalization of primary care, we bump into a serious challenges of connectivity and infrastructure. Less than 50% of health facilities have adequate access to reliable power supply. So it becomes really very challenging to start bringing digital solutions. And this is in a context of a continent where the other types of infrastructure, such as roads and water, are also a challenge. And more than 50% of the people live beyond a reasonable radius to access healthcare facilities. So telemedicine become almost for many the only lifeline when an urgency happens in a community. And without that kind of connectivity infrastructure, you can understand that is a big challenge. But we also like to look at our challenges as opportunities, because for every challenge, there is a solution. And the role of us as leaders is to connect the solution to those challenges and find the resources to be able to do that. The second challenge when it comes to the priority of innovation is insufficient investment, insufficient capital. When you look at the trends over the last couple of years, there has been increased investment into health tech, which is very encouraging. But I also want to say in terms of, in absolute terms, compared to the rest of the world, we still need to see much more investments coming into the market, really accelerating the growth and scale of those health tech innovations. And then finally, when it comes to the challenge of human resources, when you look at the distribution of human resources across the world, you'll find that there is, on average, a doctor for 20,000 people in Africa. No, for 5,000. But for some countries like Niger, like DRC, you find one doctor for 20,000 people. So how do we leverage technology to bridge that gap? I think that's the major challenge. And with that comes the enormous task of training doctors, training frontline workers, and even increasing the digital literacy in the population so that the adoption and use of digital technologies can be significant and transform the healthcare systems on the continent. So those are the major 3 buckets of challenges that I can talk about here.
That was very insightful. Daniel or Jay, would you like to jump in and share some of the biggest challenges you've faced in the region?
Well, I think in our region we have a middle maturity in comparison with other regions. We are not in the first world, but I think we are in a very good advance to achieve many goals. For example, in terms of investment, the lack of donors in our region has pushed to the governments to search for their own sources to fund the digital transformation project. So many or probably all the countries in Latin America and Caribbean are investing in digital transformation through loans, most of them provided by the World Bank and the Inter-American Development Bank. Those 2 probably are the most important investors in terms of digital transformation. So I think that we overcome that part of investment. We have a lot of technologies now, but the main challenge probably is how to put order in all these digital tools that we have at this moment. Especially after the pandemic, we have had a bunch of telemedicine solutions, about a bunch of EMRs, EHRs. We have a lot of new companies because in our region, the private sector is very strong. But the question is how to put order there, right? And we have identified huge gaps in terms of the regulatory framework, right? How to govern all these technologies. And especially because when we are talking about digital health, we are talking about the health sector, but the digital sector too. And in our countries, not necessarily the same figure, the same entity. The Ministry of Health is in charge of the health sector, but you have other ministries, in charge of the digital side, all the telecommunications, all the cybersecurity part. So that lack of governance, Jay mentioned that this is very tough sometimes to put 2 entities in the same table. So that is the biggest challenge. And to have the regulatory framework to, as I said, to have a strong governance of all the process of the digital transformation. But additionally, I think that we have common challenge, common barriers that probably the main barrier is the human resource, the lack of digital literacy, because most of the health professionals are analogs, they are not digital. So how to create the skills, the capabilities necessary for all these professionals that now they need to deal with telemedicine, to have data protection, because we are receiving a lot of cyber attacks in the health sector in Latin America now. These challenges is one of the most important barriers. The universities are not necessarily filling this gap. So that's because entities like RECAINSA are trying to promote spaces for discussion, for the convergence of the governments, of the academia, of the professionals, to discuss what is the best way to move forward the creation of this capability. So probably is something that I can mention from Latin America and Caribbean. Thank you.
Great.
Okay, I would like to echo what my other colleagues have said. I think many of the things are the same across the regions. But one thing that I would like to highlight is AHIN has been part of the Global Digital Health Monitor Survey last year in the region. And then one particular area in that across regions, I mean across regions, not just Asia, Africa, or Latin America, but across regions, the workforce is actually a weak link. This is something that, having been working closely with many of the ministries in the region in terms of supporting the national digital health transformation, I see this also a major problem, because in the Ministry of Health, in many countries, I won't say that most countries or some countries, but I think many countries still do not have their roles or responsibilities for digital health defined. Some of them still comes under health management information systems or statistics division. And of course, the trend is changing now. Many of the countries do have department of or unit of digital health under the ministry, but not many. So if you do not have a specific role or a responsibility defined for digital health or have a career pathway defined, then it's very difficult. So this is a problem that we are facing. And then also, one of the countries that we work together in terms of convergence workshops, and then we also work together with some partners to put together a capacity building program where they can actually get trained in specific areas like data science or clinical informatics. And then that country has a particular issue in terms of language. And then they had to go to another country to get trained. And then, there are another challenge. In order to take the course, they need to also take the English proficiency. So you see, the problems are not probably just one. So when you try to build capacity, you need to actually address it to that level. Of course, we were able to actually work and then also reach out to many other partners. Like, for example, if it is English proficiency test, like you reach out to the British Council in the country, and then the embassy, and many other ways of doing it in a way also to save the cost. And then we were able to get them to some level and then also send them for the fellowship. This is just one problem. And then the other one, like as Daniel mentioned, like it's also related to regulations. I think many of the countries now, the AI is the new thing, right? Like after many years, it is also now the bus. But 90% of the countries still do not have regulations with respect to AI. And in general, many of the regulations that were set in place for health is like several decades old. Now we are talking about connected devices, like my other colleague also mentioned from Africa, and then like wearables, and then we are talking in a total different era, but then the regulations are still yet to catch up. So the regulatory space, like I think my other colleagues also mentioned, we are also working together with Transformal Association for Health Data Governance. Like very soon we will be conducting the regional consultation on that. But last year we actually did on health data governance, we did in-country dialogues to get people aligned, so that unless otherwise, people actually come together and then there is more participation beyond the normal digital health or health informatics folks in the country to get other stakeholders involved. So regulations is certainly another weak link. But then, like again, I think Daniel also pointed out, the main challenge that we are facing is the resilience in terms of governance in digital health. So when there is a political transition, the whole thing that whatever, be it capacity building or capability building at a top level, with the political leadership change, the structures also change. So that is a major challenge. So how to make these governance structures for digital health in the country more resilient? So we are actually working together. We are not yet there, but again, we are working together by having a TOR for something known as a program management unit. This is not essentially the topmost layer for digital health governance, but then it's not completely the operational either. We focus on the mid-tier. The civil servants, some of them usually do not change, even when the government changes. Like, I think it's better to focus on that. Also have a TOR done. The TOR is to tie up the governance and the operational layer. And then some countries are already doing it. And then we are also suggesting that that the Ministry of Health invests in such resources. It could be called Digital Transformation Office or Program Management Office. It's basically a kind of a dedicated team for digital health with a specific UR to tie up things between the governance and the operational layer. So this is something because of the capacity we build, it takes years and then we can just lose it. So this regulations, the health workforce, again, what I'm talking about is also related to the workforce. And then another challenge that we have is standards and interoperability, of course, because we are certainly in a better place. AHIN actually is also working together with many countries, setting up the standards and interoperability labs. And then we also have a community known as COIL, that is a community of practice connecting the different standards and interoperability labs in the region. But still, we find countries still facing the issue of taking the standards. Again, as Daniel said, this is something that I mention in every meeting. There are plenty, there is no dearth in terms of the tools and frameworks, but when it comes to the practice, that's where we actually need to make sure people have something that is readily relevant for them. And then readily they can update. Even during COVID, I know many of the countries, especially the island countries, which were dependent on the health workforce from other countries, when the people could not fly in, we had all these digital public goods, which are actually open source and they are available for download and use, but then still people had a problem in actually implementing it. So still, and then we had the guides, we have the frameworks to tell like how to approach, but people still have a problem. So that is certainly a gap, I would say, of translating these different tools and frameworks when it comes to practice. It's not strictly like a plug and play. So this is again another gap we are trying to actually address by working with the countries to develop some sort of a self-sufficiency in the country, because most of the digital health blueprints or the strategy is being drawn up by consultants from elsewhere. So the country sometimes has a problem in terms of translating that into action, apart from the financial difficulties, of course. So how to actually, for example, right now, AHIN is working together with the country. I'm not naming that, but we are working together with the country for convergence workshop. It's going to happen in less than 10 days. What we are trying to do is, though we have to bring in some international consultants on a very specialized topic, we are engaging the local health workforce and then training them right from the beginning, right from the needs assessment, the landscape assessment, and then also the vision for the digital health strategy. Unless otherwise we do that, I think when the donors pull out or when the funding dries up, the country again ends in a situation where they are not able to do things on their own. So this is also a challenge. Sorry if I've taken more time, but if there is anything that I have not specifically answered, please let me know. Thank you.
Okay, wonderful. That was extremely, honestly, very useful information from the three of the speakers. I feel like we have a common thread when it comes to convergence of stakeholders, the standards and interoperability, the strengthening and building capacity, and involvement and increase of capabilities in terms of the workforce and digital health. Also, and most importantly, and something that I believe is kind of a gray area still for many countries, is regulation. Now, could you tell us more about any successful digitization of health systems within your region? Something that you might be proud of from the projects you have worked in personally?
You want me to start first?
Yeah.
Thank you. So I wouldn't say digitization, but there are efforts by different countries. Like, for example, India, they have the National Digital Health Blueprint, because there was a stage where, I think Daniel also pointed out, digital health is multidisciplinary, right? So I would put it like World Bank report calls digital in health. So that means that there are several other entities. and bringing together. So now, like India, like in the last few years, actually, the multiple ministries are actually working together. And then the National Digital Health Blueprint came into picture. And then because a country like India, I think there are other countries like also Indonesia, which also has a federal structure. In many of these countries, health is a state subject. So to have the different state governments actually coming together and have an overall architecture where everybody is able to actually work together is very, very important. So that's where I would say that having a national digital health blueprint and then also a dedicated body like National Health Authority and with a team and a structure that actually builds over the basic building blocks. So defining the building blocks for your country because you have to start somewhere. And then many countries I know that we work with still do not have a digital ID. Digital ID is something very inherent. Like for anything in digital transformation, without a digital ID, it's very, very difficult. So in that way, like if you look at the India model, like they had the digital ID, Aadhaar, and then like you have now a central authority. I wouldn't use the word authority, but then there is a structure that can actually bring together different elements, and then also one of the things that India did, I really liked is this public consultations because a country of that much variety in terms of in everything there is a lot of variety and then even if we include few thousands of stakeholders, it will still be considered that somebody is left out. So what the government did is also to bring out this public consultations. So they actually had different categories of stakeholders and had consultations and then also create draft papers, put it down in the public domain for people to look at it probably like 1 or 2 months, give them the opportunity to critically comment on it and give the feedback. So I would say that it's a major step from India. Then looking at Indonesia, amazing that they have a huge team right now because the government believes in the digital transformation. So I also can share such links in the chat. They have a digital transformation office and led by a CEO, and then they have hundreds of people working for that. So that's again, I would say, a major investment. And unless otherwise you have something like that, like it means I wouldn't say that every country may have that kind of a wherewithal of India or Indonesia, but still, that kind of political will to take that action is very important. Sri Lanka, I would say that they are pioneers in terms of building the health workforce, which is also having the skills on health informatics. For years together, they have been actually training the clinicians in taking the health informatics course and then also sending them for fellowships, clinical fellowships elsewhere in the US as well as the UK. And then many of them are now employed with Ministry of Health, WHO or elsewhere. So I would say that these are some of the successful, because every country has some bit of success and some bit of challenges. I would say that right now I will limit it to these three, but then there are many countries, including Philippines. So Philippines recently conducted the convergence workshop, but they already had a governance structure, the National Steering Committee several years back. But recently, last year, they revamped the committee. And then they also worked on a strategy from 2024 to 2028. Again, Indonesia also updated the National Digital Health Blueprint from what was 2020 to 2024 is now 2024 to 28. I would say that these are very important steps because working with them, we realize how valuable they are. I will stop it at that. Thank you.
Thank you. Daniel or Phil, would you like to jump in about like a successful project you have personally been involved with in your region?
Well, I think it's not only one entity involved in many of the progress of the countries. Probably could be very, I don't know, a good way to share with everybody that you are solving the problems of the world, right? But it's impossible, right? But in terms of the region, I think that we have very, very interesting experiences in general. One of the most successful experiences is Uruguay. Uruguay is the most advanced country in terms of digital transformation in general. And that's because they have a holistic approach. They are not working only in health or only in education. They have a vision as a country, and they have built the different enablers to have this transformation. In the health sector specifically, they have a national EHR based in interoperability. So the 99% of the population in Uruguay can go to any place, to any health facility, and they can have the continuity of the attention because all the system is interoperating based in a standard. So this is a successful case and very interesting case to understand, especially because they started with the regulatory framework. So that's probably the most important insight from the Uruguay experience. They created this framework. They designed the plan, the vision for many years, and they searched for the investment to ensure that they had all the necessary for the transformation of the country. In terms of the biggest country in our region, Brazil probably is the strongest economy, and that is reflected in the health sector. They have an interesting a blueprint now for digital transformation. They are investing a lot of money, creating capabilities. They already had a very interesting experience from the Ministry of Health with the DataSUS. DataSUS is the health information system of Brazil. And they have incorporated many standards from several years ago, but they are pushing a lot now to accelerate the transformation beyond the digitization, because I think that digitization, we have a lot now, as I said, but the challenge is how to transform the models, right? Because the model is so hard to change. In that line, probably Argentina is an interesting place to see how they have had continuity, no matter the political environment, that in Latin America is something very challenging, because you have left wing and right wing and nothing in the middle. And if a government is from the right wing and the next is from the left wing, they practically start again from zero, right? But in Argentina, they have had different changes of political ideologies in the administration, and they have had the continuity in the plan that they have of the digital transformation of the health sector. They have invested a lot of resources training people. Probably Argentina is one of the countries with more medical informatics, because most of the projects in the country are led by medical doctors that have been trained, have received training, I mean, in informatics. So this is a very good lesson. And in terms of the rest of the region, I think that even the smallest islands in the Caribbean, they already are investing to have telemedicine programs, to have national EHRs. So I think more or less those countries that I mentioned are the lighthouse for the rest of the countries. But in terms of the region, I think that we are in this middle maturity of the digital transformation. Thank you.
Oh,
So let me go last, and I'm mindful of time. I just want to remind ourselves that digital health is not an end in itself. So there are three things we always have to keep in mind as we go about digitalizing health. Are we using digital to save lives? Are we using digital to save money? Are we using digital to save time? And I feel like every time I'm asked about talking about an impact, I want us to sort of to think about the case of where we know digital has really saved someone's life. And I can tell you from my experience with the drones deployment in Rwanda, there is nothing more satisfying than looking at the smile of a child whose life has been saved by a digital intervention. So that's the example I wanted to share that I'm really proud about. We launched the drone program in 2016 in Rwanda, and such personal stories started trickling in by 2017. There was a case, for example, in the southern province when a mother, after giving birth, she was hemorrhaging, and she literally had less than an hour to live if she didn't have the blood type that she needed for transfusion. And previously, if we use the normal way of delivering emergency supply of blood, it would have taken minimum 2.5 hours. But within 15 minutes, an order was given by SMS. The packet of blood that is not stocked at that health facility was dropped from the air, and the life of the mother and the child was saved. So I think this is one example, and I know that lives are being saved on daily basis in Rwanda. And since 2016, this company is now expanded in 5 countries in Africa. So I think that's the example I'm the most connected on. But I know that, you know, lives are being saved at scale by just improving public health decision making through better information, through the implementation of health, you know, management information systems, telemedicine. But it's a constant reminder to us as public health practitioners. I hear colleagues, we always talk about, you know, percentages and so on, and millions of money or of people. It's important to always remember it's about the life of one person at some point, and let's try to learn the impact of what we do in one person's life, and then we do it at scale. Thank you.
That was very heartfelt, and I do agree. I feel like sometimes we get fed up with numbers, then we tend to forget about the people we're dealing with. So before we move on to the last question, I want to open questions to the audience in case anyone has. Okay, Fonty, do you want to come here? And yeah, please introduce yourself to the speakers.
Okay. Hi, so my name is Phunthi Bacharaporn, and my background is medical doctor from Thailand, and also full-time MPH student at Johns Hopkins now. So as you mentioned about the success of the digital health in your regions, so I have some follow-up question about that. So I wonder that you, for your region, what are the key indicator or metric that you use to measure the success of the digital health innovation, that kind of initiative, and also what are the kind of strategy that you use to ensure that the project will be sustainable? Yeah, that's my question. I'm not sure that if you not understand, I can make it more
Well,
easier.
I think I understand. And in the case that I mentioned of Uruguay, they have had strategies. They have a strategy, and they have indicators to measure the strategy. So they have had different strategies, and that, as I said, that include the monitoring and evaluation as a part of that. So this is the way that they have measured the results that they have obtained with the strategy. But I think we need more the topic that Phil mentioned, how to link the health impact to the digital transformation, because nobody is doing that, right? At least in the region, I don't know any case where you have, for example, a indicator to reduce the, I don't know, some specific disease or to amplify coverage, and that is linked with the national digital health strategy, for example. So I think that this is the most important challenge, how to measure the impact in terms of the health outcomes.
Maybe I can add a bit. I think it depends on the baseline each country can define, like, because it may not be the same. And some of these are also related to what the government or during the elections that the manifesto says, like what is that they want to achieve. It depends on each country. But in general, if the digital health strategy is closely aligned or is based on the national health strategy or the health plan, then it is better because in the national health plan you already have decided like what is that you would like to invest or what is that like you would like to achieve. This is only digital is only to enhance or a way of actually delivering it. So usually if you have a solid health plan and then put the digital ways of achieving it, then it's easier because usually in the national health plan you will have those indicators, you have those key success factors, everything identified. That's the way probably I would answer your question because it all depends on what is considered as a success. That is not the same in every country. It could be different. I may not have answered your question exactly the way that you want, but that's because it's not, there's no one single way of saying that, the success indicators here. It's difficult. And we cannot talk on behalf of the countries because they have their own, what do you call, the vision for success or like what they want to achieve.
Okay, thank you. Is there anyone else with a question? Well, I think that this was a very enriching and very thought-provoking conversation. I think that nobody of us would kind of figure it out that we have so many similarities across regions. I think that the challenges also have a lot to be like, we have a lot of space to come up with solutions. And I think that most of the attendees here are inspired by the talk we had today. So I really value your time to come to this panel discussion. And thank you for having us and for bringing your experience and your expertise to Hopkins.
Thank you very much.
You want to share one more thought that I have, or
Yeah.
or we run out of time completely? Maybe 30 seconds will do if you allow me.
No, yeah, of course.
I think one thing that I would like to share is you all being students. I'm sure that I think the students here will be from different regions. I think probably from all the 3 regions, not just from the US. So my appeal to you is like probably think this opportunity to be with Johns Hopkins, like as I see it, like because I know one of your own faculty is now leading the digital health and innovation department at the World Health Organization. And I know one of the faculty of yours is actually working with many countries, and including our own networks, and then also working on projects like Exemplars and digital health. And then you have some of your alumni, they are actually working in very good positions. And this opportunity probably does not come to everyone because the kind of exposure that you get at Johns Hopkins and the kind of faculty that you have is fantastic. So probably looking at like what is that you could do for your country after this, I think is very important because I don't want to name, there is one of your alumni and she's actually working very closely with me for her own country. She's based elsewhere, but then like she's very passionate about giving it back to her country. And she has been actually working together for a convergence workshop in spite of her other commitments. So we see many examples like this, and then I'm sure that people like you should actively participate in the regional digital health networks. Like, my friend Daniel is here, Rikainsa, Helena, then also Ahin. Like, please feel free to join these networks, participate in the webinars that we conduct. I've also posted some links, and then these are free resources. and we get some of the best minds in the digital health to come and explain and share their experiences, the practical implementation experiences, not beyond the, the conceptual or the theory part. So please do participate and join us. And then you actually should, some of you should, I should see that you join us as the working council members to represent your own countries and help your countries in their digital health transformation. Thank you.
Thank you. Daniel, do you have any final remarks before we close the session?
Well, I think Jay mentioned a lot of things, but maybe only a key topic is the community. For us, is really important as networks. We believe that together we are stronger, and this is a fact. Alone, we cannot do anything. And that's because the networking, the community of practice, the involvement of all the ecosystem is so important. And for us, the academia is a key partner in any ecosystem, no matter what is the country. So that's kind of the spaces that you are generating are really important for that, for the convergence of the different thoughts, the different initiatives, the different movements, and try to promote the use of the evidence, especially for the government. So I really appreciate the space. Well, we will have our annual conference in Santo Domingo, Dominican Republic. So you are invited to join us in July 23, 24, and 25. So if you want to learn more about the experience in Latin America, Santo Domingo is a very nice place to go. Thank you very much.
Perfect. Thank you very much. And thank you again for being here.
Thank you.
Thank you.